Call it to order.
Let's call the finance meeting to order. Roll call, please.
Pat Kinney,
Here.
Blake Ellefson,
Here.
Brad Ray,
Here.
Ron Stendor,
Here.
Dick Pufal's excused.
Thank you. Next, number 2, approval of the agenda.
Ron will make a motion. We approve the agenda.
Blake will make a second.
Any questions or discussion? All in favor of approving the agenda as presented? Aye. Opposed? Motion carries. Thank you. Next, number 3, public comments. Is there anyone here for public comment? Is there anyone online or the phone for public comment? Anyone present online or the phone for public comment? Hearing none, we will move to number 4, approval of the minutes.
Ron will make a motion. We approve the minutes.
Brad will second.
Any discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. Thank you. Next, we'll move to number 5, discussion and action items. Number 5A, M3 insurance update.
Alex, you're up. Good afternoon, everyone. Can you hear me okay? Perfect. I am here today on behalf of M3 Insurance to discuss current plan performance and also some insights into that data and talk about any questions you might have. With that, I'm going to go ahead and share my screen if that's okay with everybody.
I got to make you co-host first.
Okay.
Okay. Yep.
Just let me know when you can see that.
Yeah, we have it.
Perfect. So we're going to start with the current plan performance. And then I'm going to talk through some of the reasoning why, including some benchmarking information that we compile at M3 that compares you to your peer groups. We're going to talk about other components into the why behind the performance, including top provider report, some initial repricing information that we've received from the market, and then just talk about the evaluation process for potential movement for 2025. Is everybody okay with that? Okay. So looking at the current performance where we sit as we evaluate this year through June, we do see the spike if you follow the blue line. And what this indicates, this blue line is actually where the plan is performing. The orange line is what we've budgeted towards for the health plan performance. This is M3's proprietary health plan performance monitor. And what it ultimately does is it gives us a gauge in terms of how the dollars you're putting into your health plan are being spent and when and where they're being spent. With this, the first number that we see in the left-hand box, 71.8%, gives us an idea of how your plan is performing according to how you're funding it. And obviously, a number less than 100 is what we like to see in this box. So that's a healthy number, 71.8%, which equates to a funding difference that there's a $495,000 surplus in there currently. And then moving over to the next box, we like to evaluate employer groups based on a per employee per year cost. It helps us to really picture what it looks like in terms of a real world budget when it comes to talking about employees. So right now you're sitting at $19,975 per employee per year. And I'm just going to zoom this in because it's a little small on my screen. And you can see the prior year at this point, we were at $25,645. And then, so then you see this blue line, and you might think, well, that should indicate we're spiking or doing worse. But because we were running below what we had budgeted for a number of months even with this spike in June, ultimately, it's still leading to that surplus number of $495,000. Now, that's good news. It's exciting, but I want to temper that good news with a little warning, which is in February, many healthcare providers experienced some negative blowback from the Change Healthcare data interruption that occurred. And what that was, Change Healthcare is facilitates billing for many providers across the country. And so what we have seen is there's been a lag in terms of claims being submitted to health plans from when they actually happened. And now we're starting to see those claims from January and February catch up. And that's why we see this hockey stick here on the right-hand side of the column. So when we look back at last year, how does this relate? So for the time frame the exact time frame from last year, this is screen number 2. We can see that we did have a little bit of an increase in the same time frame, which makes me feel better about what we're seeing now. Maybe we're out of the woods on the claim lag from that data interruption. But ultimately last year, we were above the budgeted orange line more than we were below it. So I'm encouraged by that information, but still, what's driving the numbers for 2024 and what's really impacting that? When we look at the plan performance, the big components are plan design, contribution, and of course, one thing, the unknown, and if anyone's following the news from Madison, Act 10 and the possible repeal of that in the future is another component we're watching very carefully. And as I move to the next screen, I just want to discuss current plan design. So currently you have a $2,000 single deductible, $4,000 family deductible, and then 100% coinsurance after those deductibles are met. The way the plan is created or operated, everything goes towards the deductible except for prescription medication. There are co-pays for members for the prescription drugs. So the pharmacy benefit is the only component that does not go towards that deductible. Any questions so far? Great. So how does that stack up with your peers? We have the ability to benchmark your plan, your specific plan design, against about 157 other plans in the public space, made up of municipal, county, and school district. And this is how you stack up. So from a out-of-pocket perspective, and again, thinking back to the possibility of Act 10, your per employee per year cost being a little bit on the higher side. One of the components that's driving that is you're relatively low, speaking to the rest of the marketplace as far as out-of-pocket amounts go for your employees. We can see here that the average is $2,300 on a single plan deductible, and you guys are coming in at $2,000. And then 100% coinsurance after deductible is met, where the benchmark average for your peer group is about 93%. And so when we move to this far right-hand box up here on top, that shows your average cost per employee per year being at $28,347. That's contributing to it. I'd not call this a rich benefit plan, but it's certainly richer than most. The other component I'd like to call out in regards to why this number is higher than your peer group. If you look to this box, which is the rate metrics box, which shows where you fall against your peers as how much you contribute in premium to your employees' health plan. Right now, Ashland County is contributing 90%. And the average in the public space right now is 72%. So you can see where if you're only contributing 72%, this per employee per year cost, which includes the amount of premiums paid by the employer, is going to be higher based on that contribution amount. That's not the full story, obviously. With the per employee per year cost, we're also looking at claims, how much comes out of that claims funding when you're a self-funded health plan. The other thing to note in this data, out of the 157 active plans that we're looking at benchmarking you against, the 157 peers, roughly half of that group have a qualified high deductible health plan with a health savings account attached to it. And with that group of plans, you see much higher out-of-pocket amounts for the employees, which again reduces that benchmark average for per employee per year expense. And I'll pause there. Any questions or comments so far? I've never put anybody to sleep that quickly talking health insurance. I think this is a record for me. So that's the benchmarking, and why I really like this is it gives a nice overview of what's happening in the public space and where you stack up accordingly.
Alex, this is Pat. You've said 157 peers, and then you've said public space. Are all of the peers that you are identifying in the public space?
Yes. Yep. So for the purpose of this benchmarking report, we're only looking at public entities. Great question. So,
And as we go forward, you pointed out how Ashland County compares to peers. At what point do we start having a discussion about healthcare plans and costs for next year?
oh, you're reading my mind. Moving to that very quickly. The first thing I want to point out as we make our way towards 2025 and what to expect and, potential options out there. I just want to do a quick review on another reason the per employee per year with Ashland County is a little bit higher than your peer group that we're comparing you to. One of those components is this slide, which highlights the top providers for Ashland County. Now, obviously provider on the left-hand column over here, the number of claims. This can be, one person with 20 claims. It could be any number of patients walking through the door with Ashland County's insurance, visiting a facility and walking out with claims. So from both that claim count and the billed amount, Tamarack in either Ashland or Hayward, we combine them for the purpose of this report, is by far and away the largest from a dollar amount perspective, which makes sense. Local community hospital and clinic in Ashland, that makes total sense. Second highest, Essentia, almost the same number of claims, but the dollar amount is much, much smaller. But the one that's surprising to me is North Lakes. Is anyone here today familiar with North Lakes clinics?
Yes.
Based on the data, what we're seeing in terms of price per unit of care, North Lakes is an excellent opportunity to explore further. And as we look at 2025, what can we do to lower this overall claim spend and possibly reduce the cost to the employees at the same time? North Lakes is starting to become a leader in that space, and I'm a little excited to dive in and chase after that relationship. But I'm getting ahead of myself a little bit. So what we've done so far in terms of setting the table for 2025 and really starting to evaluate the opportunities for 2025 is we've begun requesting repricing reports. So one thing we want to look at is currently you're using a few different national wrap networks to access healthcare for your employees. One of those, Health EOS, and then First Health. So in terms of looking at total discounts, are we getting the best discount with each provider that we could be? And it's a good thing to evaluate this every year or 2 years. And we feel very strongly that now is the time to reassess those network choices for both adequacy. Are they delivering on the providers that your employees need to be able to get in the door at? And then secondly, are they delivering the best negotiated rate that we'd like to see? So far, we've received a few back. The Alliance is a PPO network here in Wisconsin, formed in Wisconsin. It's a cooperative type network, which is a little different than some of the larger PPOs. They're very Wisconsin focused, Wisconsin and Minnesota focused. And we can see that based on initial repricing of 2 years of claims data, they would save roughly around $500,000 had they been your network over that same time frame. There is one caveat, which is when we evaluate claims data, the eligible amount was supplied instead of the charged amount. And this is health insurance games, a little bit, gamesmanship. But that would likely reduce the potential savings by 2 to 3 points. So ultimately, we're probably looking at a 10% savings as compared to the current network arrangement. So for 2025, I think, moving forward with this repricing, looking at a few plan design options would be in effect. One thing that we see, and we've been very effective at doing, and that's my next slide, is steerage. It's funny, I've been in this industry for 25 years, and when I started in health insurance in central Wisconsin, we had what was known as gatekeeper HMO plans. If you're not familiar with that term, it's essentially a product that's set up that says, hey, employee, you have to go here. And they quickly dissolved because you can imagine it wasn't very popular, as employees like having that choice and the ability to go where the provider that can best suit their needs. But we're kind of getting back to that in a few small ways, and not so much from the you must go here, but more from, hey, if you go here, there's going to be some savings. So one other component of the evaluation process for 2025 is looking at the appropriate incentive level and plan design so that employees become good consumers of healthcare and actually make the choice to use the high value providers that will deliver less out of pocket to them so that, their medical debt load doesn't increase, or possibly we could eliminate it. And then it also reduces the overall spend to Ashland County. And a couple of the examples here in this chart that we're looking at, Cellfund Health is a company that has two main components, and Dan was in a meeting with us as we evaluated this potential vendor for 2025. And like I said, this is one of many that we're evaluating. I just brought this data today to highlight the type of savings that are available by approaching the market with a little bit different philosophy. So the strategy here is to incentivize employees to choose the appropriate care path that results in, for example, the knee replacements right on top. The 2 knee replacements that were done in the previous year, we had the opportunity to save around $150,000, those knee replacements, by the employee selecting a different provider. in many cases, are they gonna have to travel? Yep. But the advantage with working with a product design and a company like this is that the employee would have no out-of-pocket expense if they make that choice. So they can still choose, do I want to go to Lake Walk? Do I want to go to Essentia? Do I want to go to Tamarack? Or if I don't mind driving to Minneapolis, I could get it for free. So incentivizing the appropriate choice is one of the avenues we're looking at. And I'll pause there before I talk about the total estimated savings. For any questions.
Alex, this is Blake. We had talked quite a bit about an HSA option. You had said that helps with the overall reduction of per employee cost often because they often take ownership and, it's a lower cost to the county. Do we still plan on rolling out an HSA at the county level?
I think it's worth looking into and modeling that. And we have the capabilities at M3 of modeling that plan design. I have a little bit of a hesitation right now for two reasons. Number one, Act 10, the potential of it going away, and setting a plan design that could possibly we have to revisit again in another year or two. I think there's value in offering sometimes dual choice, right? A traditional product, much like what you have currently, alongside of the HSA, letting employees choose. But ultimately, my biggest hesitation with an HSA is what we see a lot of times is the deductible has to go up, obviously, to keep pace with the IRS limitations on deductibles. So the added out-of-pocket expense, members typically don't enjoy that. And then the other component to that is the prescription drug coverage. That's really where we see the pushback from employees. And the one danger there, you'll get sort of pent up demand. But I think it's something we can certainly look into because you're right, it will reduce premiums off the bat, obviously, and it will cost shift a lot of those claims costs back to the employees. And as far as highlighting the differences between, let's say, a plan and like what I have up on the screen versus a high deductible health plan, where employees are shouldering the first $4,000-$5,000 of out of pocket, depending on contribution amounts. If the county wants to contribute to a health savings account or not, it ultimately depends. And so that modeling that we can perform will give us really good insights. And then a big component of that too is talking with Dan and possibly rolling out a employee survey just to get a gauge for where are the employees at, and what kind of disruption tolerance do they have to that out-of-pocket expense.
So, excuse me, Alex. So I did have a department head meeting this week and did get feedback from a lot of employees. They want no part of anything that's going to raise their own cost. If the cost stays the same to them, they're happy to do an HSA. But if we raise deductibles, they don't want any part of it.
Yeah, and the one thing with
I
that,
get they're saving, it's the initial hit that they're worried about, not when they actually fully realize the benefits in 2 years. And
So they're completely different types of plans.
Right.
One is where the county kicks in, let's say $1,000, $1,500 day one
right,
into this HSA. They set aside monthly
right.
into this savings account.
I understand
It's
that.
geared specifically for people who are obviously not having a lot of children and expenses. So it's not for everyone.
No.
And I think that's the key is education. If we don't want it as a county, we don't have to talk about it. If the employees don't want it, it's not a big deal. I
Well-
was more under the impression like, hey, this is a benefit to people who are getting closer to retirement,
Right.
want to save their, are relatively healthy can do these things to get more money. Those were my idea, but we don't have to talk about it again if the.
Well, no,
employee-
I think it's still worth modeling it and then showing employees, this is what we'd be looking at, and then getting their opinion again when they can actually see the dollars and cents on a piece of paper. I think that's important. But as a general rule, they don't want their healthcare, their costs for healthcare to go up. No matter,
Yeah, and-
and that's the feedback I got. We have one here, you can ask him.
I think, one thing to add to that is the current plan design allows for prescription drugs on the copay first. So if I have the generic medication, let's say, the generic for Vyvanase, which is, ADHD medicine, is still $234. But if I fill it under the generic, then I pay the generic copay. Right, which is a $10 copay. So if we go to a true high deduct HSA high deductible health plan, then that generic, that $234 generic goes towards my deductible. And yeah, there's $1,000 in my account where I can start paying for those drugs right off the bat. That eases the pain. But generally, when we make, especially in public entities, when we make that leap to HSA or qualified high deductible health plans, that's the one concern. The area that people are going to push back on the hardest will fall into that prescription drug component. Obviously, the one thing they're doing every month with their health plan, and sticker shock, usually that's where it comes from. But we have some capabilities, and even looking at that, we'll probably even be able to call out what that would look like for the insured member base. So I just want to highlight on this last slide, the opportunity for savings in the environment and the geography that you're in, on top of making a network change. We're talking about $800,000 in potential savings, which is, your total claim spend is between 5 and 6 million on average for the last few years. It's a significant amount of savings. And we're also looking at repricing from a few other networks, and there's a few other insurance carriers that are throwing their hat in the ring to have that discussion, specifically around steering employees to the high value providers. And what can we do to build out the appropriate incentives in a plan design so that employees can make those informed choices moving forward, so that it lowers their out-of-pocket and then ultimately Ashland's overall claim spend. And as we move forward, we should have the repricing. First week of August, we'll have the repricing back from America's PPO. We'll have the full analysis from the Alliance. We're also talking to Security Health Plan, just based on their discounts with Essentia and the high amount of claim volume that you have there. And then, like I said, we're having conversations with providers on the ground in order to see what we can put together from that perspective. And one thing I'll leave everyone with is, steerage and making sure employees are getting in and getting the care early versus waiting for a high cost claimant to pop up because, they didn't feel like they had the ability or the means to get in and get it taken care of. It truly proves the old saying, an ounce of prevention is worth a pound of cure. Any questions, comments?
So, Dan just said that employees don't want to pay more cost, and yet we're showing that the average price per employee is way higher than our peer group. Almost $10,000 a year per employee more. And so I see that we have to somehow reduce costs. Are you saying that through some of these savings plans that you're looking at, that we're not gonna have to raise premiums or raise cost to employees and be able to get that average cost per employee closer to that 19,000?
Yeah, by approaching where the dollars are going to from a provider perspective, I think we can. I think, ultimately from a stop loss, it's too early to tell what a stop loss renewal looks like right now. And most of that's based on the claims lag that we've experienced for the first 6 months of this year. Because of the Change Healthcare disruption in service. But yeah, ultimately, when we break that number down, and to your point, so you're about 40% higher in terms of per employee per year costs, and but you're contributing, the difference between 72% and 90%. I know when we look at that, well, it's 18%, but if we take 72 as the baseline, that's actually a 25% swing. So then that's contributing to that $28,347 number significantly. So fairly rich benefits currently, along with a really generous contribution model, absolutely is playing into the $28,347 per employee per year number. The other component, though, very strong component, is where your people are choosing to doctor and the contracts that are in place currently.
So just one point on, so Tamarack was the number one. And, for me, I think showing the executive or whoever we're talking to at Tamarack and trying to say, hey, this is the most material one that we should, I know North Lakes is something you want to steer towards, but people are using Tamarack, so we should focus on trying to get them to agree to say, hey, we want your Ashland County people coming here. Then help us do that, right? That would be my big thing. And then the other piece is, I know this comes back to, the whole compensation picture for employees, right? Ashland County, from when I started, we were under probably compensating employees, but they obviously were having that made up by a pretty rich benefit package here. We've gone through the wage study now, and we've upped comp on many or most employees. We never really did adjust up on the shared costs. And so when employees come out and jump on their managers about, we don't want our costs on health insurance to go up, well, then we need to say, hey, if you guys don't want that, then the steering thing becomes the key story for our employees to hear, to say, okay, fine. You like your rich benefits, you like how much we're setting aside, then you got to use these providers, because that's the benefit that everybody gets. And I think obviously it's education for employees, but the heads of the departments need to kind of be saying, hey, we've got a rich benefit package. Let's try to keep that by helping the county board make these decisions for us.
Well,
Yeah.
a lot of them are online right now. And just heard what you said. And most employees will probably be watching this video tomorrow. So I think the message.
Yeah, well, and here's the beautiful thing, and so I want to talk about this as long as I still have the floor, as long as Dan hasn't tired of me yet. But this last page that I brought up in terms of potential savings if employees select the appropriate providers, right? This is key. So we have a number of employers in the public and private space that have successfully rolled this model out to employees and have seen significant savings. So when we look at the per employee per year cost of an employer group that's plugged this model in, over 2 years, I have an employer that went from about $19,000 per employee per year down to about $10,000. Now that's not typical, but it was with an employee base that was willing to certainly work with the employer, kind of based on like what you said, as far as education goes, and the realization that, hey, if I don't have to pay my $2,000 deductible if I go to this provider versus that provider, you know, I'm the kind of person that, look, I'll drive 4 hours to save $2,000 on a brand new pickup truck. So if I can save $2,000 on my brand new knee, I'll certainly drive an hour and a half to accomplish that. But yeah, I mean, look, this model, as far as number one, assessing, you know, who has the appropriate level of contracts, both for who's in network and what they've agreed to from a pricing standpoint, and then calling out the high value providers that are positioning the high quality along with the pricing component in a way that members are incentivized to go there and follow that path. That's completely doable. And it works. I mean, we've got real world results and to back that up. And so some of the things we'll be talking about in August in the near future are how to, you know, accomplish that, and who are the partners that can help do that. As far as plan modeling, if we want to see any potential different, you know, whether it's a qualified high deductible health plan or shifting the prescription drug copays to a deductible standpoint, we can do those things. That's going to take about 3 to 4 weeks at this point in time, putting us into, you know, tail end of August. But I guess from my point of view, if anybody has any anecdotal data to share in terms of, you know, what you're hearing on the street or from the employees, what's important to them, that's always helpful in engaging, creating that appropriate incentive to make sure that, you know, the employees are being taken care of. And it results in a win-win as far as Ashland County's claim spend not continuing to rise exponentially.
I'd be interested in hearing what employees think about having to drive to Minneapolis for services, because I personally would rather pay higher premiums to not have to leave the area to go get health insurance.
This is Gary. I have a question, and this is just my interpretation, and I can be corrected. But say that knee replacement, one knee replacement's 117,000, if I'm looking at it right. So you're saving 40,000, or your preferred pricing's 40,000. The savings is 76,000. Of that 76,000 savings, you could tell the employee, we will not dock you the pay while you're gone for the knee replacement. We will pay your motel and your expenses to go there, and you're still saving $70,000 for one situation. Now, is it a problem driving that far? Yes. I mean, I recently had to go to Wausau for surgery because that's the only surgeon that was available. But in this situation, you're going to save $70-some thousand on one knee replacement if they go to that preferred surgeon. And if the county said to the employee, we won't dock you your pay while you're at the surgery, time to and from, we will pay you your wages and your motel, we still would come out with a huge benefit there on what, if we could get the employee to do it.
Well, that's the idea, that they would not lose any vacation time or sick leave or whatever. So the time would be covered, their mileage would be covered, hotel, meal for the person and their spouse. You know, and however long it took. I mean, theoretically, I mean, we had to fly them out to Utah, and it's still saving 70 grand, and it's still worth our while to do that. Now, the self health fund or whatever it was, you know, they're gonna do something a little bit different, in that they'll actually call the employee up and direct them to this whatever provider it is, and explain to them that, you know, all the benefits that are provided both to the county and to them in hope of getting a better chance of getting them to do that. Personally, I would drive the 4 hours to Minneapolis. I mean, I know for a fact in Appleton you can get an MRI for $600. I mean, it's advertised all over the place, you know. And I certainly go to Appleton. But Alex, can you talk about the savings, if any, from the switch to Scout RX?
Yeah, we are currently evaluating the true overall savings that we've seen on Scout. I think we've seen quite a bit. The process, I think we can agree, is a little bit manual, but that's something we'll be able to present in full in about 2 weeks. Also, at the same time, we'll be able to present alternatives and that's what I mean by evaluating the true savings, doing much of the same claims repricing over the last year or 2 years that we've had Scout, and comparing it to, well, what would it have been with another 3 or 4 of the top prescription drug services.
Alex, this is Pat. I was a public employee in this area and I was on the city council, and this plan is very kind to employees. Many other people in the public sector a decade or more ago had their health insurance plans, so they were less generous. The county, for various reasons, has not changed. I do think the county is going to change going forward, because as we look at all things finance, this is one of those stones that we really haven't overturned yet to get there. To the extent that we can get there by finding savings and having employees make choices that benefit both them and the county, that would be a goal to move in that direction and do as much of that as we can. But what happens, when we're a bit of an outlier, is sooner or later things revert to the mean. It might be a different group of board members, administration, et cetera, but in all likelihood, things are going to transition towards, the average of what other public employees are, paying and their plans. We did do a wage study recently. We did our best to adjust wages to get that in line, but we haven't dealt with this for various reasons. So I think employees are aware that this is a topic that we have to give more consideration to and try to be as fair as we can and do as much as we can. But I think any expectation that things stay the same long term, I think those expectations are not realistic. Regarding the HSA, more than a decade ago, I enrolled in that. I taught math. The accounting and teacher locally enrolled in it. And we were the only 2, to my knowledge, that did initially. We're looking at numbers, but we were also relatively healthy, starting to eye up retirement. But it didn't take that many years when the 2 of us enrolled in HSAs and said, hey, here's how we see the benefits. A lot of other people did. In fact, it wasn't very many years, 3, 4, 5. The majority chose the HSA. So based on that experience, I think we should look at rolling out an HSA before too many more years go by. Let a few people enroll in it, that want to. But then, Alex, this leads to this question. Ashland County has a somewhat small pool of employees. And if you model that and you get relatively healthy people eyeing up retirement that are picking the HSA because they think that will likely work for them, how does that work as far as your modeling in terms of the price for those plans if some relatively healthy people, and often, just single or a married couple, are picking that, pulling those people out of your other pool, the rest of the pool? How does that work?
It's a great question, and I hesitate to answer it because you're a math teacher. I'm joking. It's a bad joke. Sorry. No, great question, and certainly adverse selection, and that's sort of the term actuaries will use in that case, where you do have the healthy folks gravitating towards one product and the higher utilizers gravitating towards another product. And so when our underwriting department at M3 starts looking into those numbers, it is factored in there to the degree. I can't answer that, specifically what, what percentage do we assign to that, or how do we actually build it into the calculation? I'd have to go back and ask them. But yeah, it's a component of the modeling. And ultimately, unless there's a contribution, and this is the other component that would be really helpful in terms of if we're going to model an HSA plan, if there is, an upfront contribution that'll be made on behalf of the employee, that tends to skew enrollment as well.
So earlier you mentioned the possibility of offering 2 plans, which has come up before, but then the perception was, or the direction was, we're only going to offer 1. So you mentioned the possibility of 2, which is what my employer did. And their hope was that people would gravitate towards the HSA over time, which happened. But initially, most people didn't want to, especially people with young kids. So can we, practically speaking, with the size of our pool, offer both?
Yeah. And again, it's going to depend on, if there's going to be a contribution from the county or not.
I would say that the county is definitely going to contribute to incentivize, right? So I would model upwards of 2,000, maybe 1,000, and then in July. So at US Bank, it was 1,500 June or Jan 1, 1,500 July 31st. So we got $3,000 put into our HSA. I put in upwards of 5,000 because we were, so again, these are only, but we want to model it so that we incentivize people to start that, because long-term we benefit, they benefit if they use it correctly. And
Mhm.
it's an educational thing. If you tell someone, hey, my out-of-pocket could be 6,000, nah, I'm done. I don't want to hear another word. But if you hear that, hey, if you got 3 years and you're relatively healthy and your wife and, you could build up $50,000 in your HSA before you retire. If if you're like Pat Kinney and you've done your math and you're a math teacher and you understand that. But again, it's really just education, and having someone educate, because there's a fear factor in any type of change. And so I don't think we're going to roll this out this year based on what the employees are saying, based on all the other savings you can bring. But I think long-term, it's a conversation that we should have. HSA is an option.
So I'm going to ask the administrator and Alex, both of you, do you want to have a conversation between now and next meeting and see if it's worth considering offering both plans next year? And I'm thinking about the time that it takes both of you to consider, putting together an option for both. And if we're going to, then you can work on it. But if it's recommended that we not, for whatever reasons that you can explain to us, then we'll not pursue offering both for the coming year.
Oh, well, Alex, can you touch on your Act 10 concerns?
Yeah. So one thing I'm concerned with, if Act 10 is pulled back or modified, how do we what benefit strategy do we want to lay out now in preparation for that? Because if we're going to contribute the initial year, assuming there's a health savings account qualified plan in place when Act 10 is either repealed or modified, basically what do we want to have there in terms of how that plan or how Act 10 being repealed or changed will affect it. And so I guess for anybody that's been involved in the public space, since Act 10, I'm open to suggestion there, but basically where we're leaning right now is assuming that it probably over the next 2 to 3 years gets walked back. And then we see probably a strong push to richer benefits.
Just so everybody knows, about a month ago, a court in Dane County overturned Act 10. So that's headed to the appeals court now. And depending on what happens with the Supreme Court race in April, I would fully expect the state Supreme Court to uphold and repeal. So, and we could expect that to come as soon as this time next year.
So this is Pat, just for clarification, if Act 10 is repealed, does the healthcare plan and compensation that is in place at that moment in time have any bearing on what the healthcare plan and benefit and compensation might look like once Act 10 is repealed, if that happens?
I think that's a great question. And in terms of being able to answer it, I don't know that we have enough information at this point. All things considered, if we can make movements now to create savings and build a more sustainable product for Ashland County, that'll position you better if and when Act 10 gets rolled back.
And I'm going to ask the administrator, we have one of our financial consultants with us, Steve Corbelli. Ashland County ran a deficit on health insurance with the employees for a number of years. Does it make sense to consider that deficit prior to the possible repeal of Act 10? And if so, how do we consider it?
I would say we wait to see. That 1.3 million deficit is a debt owed by the employees. And so we can't just write it off at this point. So I think that would be part of any discussions post Supreme Court ruling.
Yeah, Dan, if I could just maybe chime in on that. My recommendation would be to not take the responsibility 100% by the county to fund that deficit. As Dan indicated, there's a contribution from both the county and the employees for the premiums, which were not sufficient. That's why the deficit is there. If you take full responsibility and put the money in there, then you've just taken responsibility. And I wouldn't recommend doing that at this time. Especially it looks like, this year, your plan maybe, hopefully, could end the year with a savings, that would go in there to reduce that. So that's my opinion.
There's one other component, Alex, that you didn't talk about that I think could offer savings in the future, and that's the direct primary care.
Yeah, and that's one of the conversations we currently have. And obviously in healthcare, 80% of the care typically comes from primary care or family practitioners. And one area of success that we've had when controlling overall spend on health plans is by plugging in what we call direct primary care. So essentially what that is, we find a primary care provider that's willing to contract on a subscription basis. And usually it's a per employee per month fee, regardless of how many times the employee and their family goes in. The employee sees no out of pocket to utilize that particular provider. And the county only pays a set amount per month for that employee to utilize the provider. Again, unlimited times, or a lot of cases, 0 times. And like I said, we've had a tremendous amount of success with multiple employers that have utilized that strategy to get a control over about 80% of the healthcare spend. Obviously, you still have to have hospitals, you still have the emergency rooms, for all the things, heart attacks, childbirth, that type of thing. But it does help reduce a big chunk of that primary care spend. Also, it builds in another component when you start talking about steering employees to the appropriate, high value providers. The direct primary care is your quarterback in achieving that. And so, yeah, that's another strategy that we are in conversations with to see if we can develop for Ashland County. Right now, given your geographical footprint, very few options. for that conversation, but we are pushing forward with a number of vendors to see what that potential is.
And this is something we could team up with the city and the school on to save all three of us money.
Right.
And the school and city in particular are looking at major budget cuts next year. So any savings they could get would be extremely helpful for the entire community.
So on the 1.3 million deficit, because the employees were undercharged a number of years ago, in the healthcare plan going forward for the coming year, are we going to try to set up a plan that helps to reduce that deficit? I mean, it's there and it's been there, and sitting for a good 3 years. We've got the rates in the ballpark of what we need to charge, so the employees are paying 10%, but we haven't addressed that deficit. What are the plans or strategies or considerations on what to do with that?
Well, I think we need to try these savings options that Alex is talking about and see if we can't start building a surplus in our healthcare fund. And I said this before, build a balance so the healthcare fund becomes sustainable in case of a bad year, and then use excess money to start paying that back. That would be money that both the county and the employees are paying into it. So the same group of people that caused the excess, we paying it back.
So if I rephrase that, if we use a strategy like that and the employees do what they can to work with the county on saving money, and whatever strategies that we can put forward, if they will do what they can to the extent that they're able and willing, that will help reduce that deficit.
Yep.
Because the alternative would be to raise their rates to address that deficit.
Correct. Correct. And I'm not sure raising rates, right, is the way to do that. I mean, there are a lot of employees who got that benefit from that deficit who are no longer with the county. And I don't know if it's fair to make current employees and future employees pay for past employees.
I think what Pat's saying though is that the times have changed within Ashland County where those previous employees that were most likely underpaid and getting the richer benefits that caused that deficit may be gone. But now it's flipped where they're making, the wages are higher and we haven't offset the health insurance stuff. So I was fairly shocked finding out that we had a $1.3 million deficit for employees. I think them hearing that and them understanding our situation here at the board, trying to make these decisions, helps that discussion of steering, helps that discussion of coming to the table to say, hey, we are in this together. We want you as employees. We like you, we want your benefits to be really strong, but this can't go on forever with this deficit. That's really what Pat's saying.
I mean,
guess-
Dan, can I?
Yeah,
Yeah.
please do.
Yeah, so the deficit that's in the fund is not all the employees' responsibility. It was due to the premiums not being high enough to cover costs. So during that time that deficit occurred, you'd have to look at the pro rata split of your premium, which I think on the previous slide was 90-10 or something like that. So 10% of that would be the responsibility that the employee didn't pay over that period of time. But 90% would be the counties because they would have picked up their employer share. Does that make sense?
Yes, that makes sense. And obviously what Blake said is I think what everybody on the board prefers is that we find a way of working together to lower the costs, as people get health care. So if they are going to be willing to go somewhere else to have a knee replaced, yes, it's not the most convenient thing, but if it saves $70,000, that obviously helps everybody, taxpayers too. But then in the long run, Steve, we want to be done with this $1.3 million deficit on our books. And so we need to work through this issue on the employee share. But then for the county share, how are we going to, if you will, fund that or deal with that so that that's off our books too?
Well, if the healthcare fund is making excess, is having excess cash, it's already funding that. So if you use excess cash in the health plan to pay that, start paying that down, it's being paid down at the 90-10 split. So it's proportionally, it's equally going down. Also,
Yeah.
again, this is an issue that we should wait to see what the Supreme Court does.
Yeah, I think Alex, I don't remember your slide, but I think currently the plan was like 493 running to the good, meaning there was surplus in it according to your past 12 months or something like that, which wasn't the fiscal year of the calendar, but it looked like for most of 2024 we were running under our stated rates. Yeah, right there. So to kind of to hopefully try to shed some light on this, if the year ended today, or as of the date of Alex's slide, $495,000 would be sitting there that would go into the fund that would lower that deficit from 1.3 to say 800,000. I'll just round up to $500,000. And that's hopefully how you are correct, Supervisor Kinney, that you need to look at plan design things that are gonna hopefully allow your plan to run under your stated rates over the next couple of years so that you can make that up. And you know, some of that's plan design, some of that's luck too. You know, it's just, you know, that people don't hopefully have health conditions that cause a lot of expenses. I mean, some of it's genetics. We can't control that. But to the extent we can control things, that should be the focus, in my opinion.
Anything else on this? We've got a few other things on the agenda. All right. Well, thank you, Alex.
Alex, I'll let you know when the next meeting is.
Perfect. And I look forward to having the conversation about the split plan design. And talk about that. Thanks, everybody.
Next, we'll move to 5B, Financial Consultants Update with Mike and Steve.
Steve, I'll make you a co-host.
Oh, okay. Thanks, Dan. Oh, let's see.
Sorry. Oh, sorry.
All right. I think I have it there. So I don't know if everyone can see this or if you've received a copy.
Yeah, we can see it.
Okay. So this is the 2024 budget report like we typically go over with you each month. So this breaks down your county budget by funds, which you'll see here on the left side, tax levy supported funds, non-tax levy supported funds, major funds, which are, you'll see highway on here twice, basically, the Highway Internal Service Fund and the County Roads and Bridges Fund. The Internal Service Fund is the business of the highway. It's the employees, the machinery. It does the work. And then it typically bills 3 customers, being the state, local, towns, whatever customers in the county for the work on the county roads. This County Road and Bridges Fund is what this fund bills for the county road work. Okay. I don't think a lot has changed on the county road and bridges numbers if you compare this report to the one last month that Mike did. We're understanding that in the highway department, they switched over to a time recording system and there's some issues with that. The last contact we had, which was Mike, I think, talked to Marcy at Highway today or emailed. Hopefully that will be rectified so that these numbers reflect current situation, which currently they do not. So that's going to be a little bit of an oddity in your report this month. Your general fund, if you compare 3.6 million compared to 2.5 million last year, I think the biggest component of that change, being that this number this year is higher, is you received a payment from the state toward the Sanborn tax issue, which has not been resolved in the accounting method of reducing your receivable on your books and flushing that all out and getting rid of the unpaid taxes. It was deposited and that needs to be completed yet. So that, I think that was 1.8 million. And then I think there was 150,000 payout of chargeback of taxes that were paid also out of there. So
Yeah, and it's gonna be
Together-
another 100 or so next year.
yeah, so I mean, that's gonna be an anomaly from, if you compare 23 to 24, right off the bat is that. And then I was texting with Amber. There's a little bit of an oddity here too with human services, which we will get to the bottom of, but it appears that either something wasn't posted or something for, so the county did receive the cash from the state, but there's a clearing account that it runs through when the treasurer's office receives it. And then the department records the revenues. The revenues weren't recorded for about 900,000 of it, which would pretty much bring this up to actual compared to 2023. So we're working on that. Just to point that out. Going down the report here, you'll see here in forestry recreation, you're like way over budget on revenues, which, you know, is a good thing, but why is it that way? We checked into it and there was a sustainable forestry grant that apparently you hadn't gotten the past couple of years for whatever reason, and it wasn't budgeted for, but you did receive it this year. So that's, you know, an increased revenue there, which is good. You know, it's going to be spent for the intended purpose, and that's the reason for that variation there. Kind of going down here on expense wise, general fund mapping pretty true to last year, both there and human services very close. Again, the road and bridges fund is not accurate because the billings haven't occurred yet. Debt service very close and is tracking to what we would expect. The one thing I'll say here in the ARPA thing, you're seeing 399. I believe that most of those expenses are for your courthouse kind of facade improvement, the roof and things like that, the tuck pointing. So that's the reason those numbers are there. I'm just looking here. Yeah, I think those are the major highlights of what is included in your report that we noted. Mike, I don't know if you have anything else to share on that or.
I can just add on the county road and bridge fund. The last I heard this a couple hours ago is that should be all cleared up next week. So we should get you'll see the numbers significantly higher in county road and bridge fund next week. So
you won't see it till your next monthly meeting, but we're on it and we'll make sure it gets done.
Any questions?
Yeah, I just have one. So Steve, when do you think we should start dealing with the Sanborn issue?
Well, I think, you know, I think we could do that right now. I mean, I think between the property listing office, I know Mike, you've worked with Jen on that a little bit.
yeah, I think we have the numbers to, and Dan, I don't know if you know, you did get a draft of your audit report today.
Oh, no, I don't.
And I'd like to talk to you about that because that does affect the audit report a little bit. And
Yeah,
I'd like to.
Well, I did talk to the auditor when he was here and I gave him a copy of the joint finance motion, letting him know that we're going to do something this year. I guess that's something we should bring to the county board to vote on, to actually do it, since we're talking such a material amount of money. So I guess I'll talk to you guys later about a resolution for the.
Yeah, are you around tomorrow morning, Dan, or?
Yes.
I can call you like between 9:30 and 10:30.
Just let me check my calendar real quick.
Yeah, I can. Because there's some, you know, I want to propose a change to that draft audit report.
I should be available around 10.
Okay, I'll try and call you around then and we'll see. We'll connect somehow tomorrow.
Okay.
So, yeah.
So
Thanks.
There is just one other thing I thought of as I'm sitting here is, in this general fund, 8,196 number of budgeted revenues. The county did budget for the Bad River Patrol revenue, which was like 400 and some $1,000. And of course, I believe everybody is well aware, kind of the dispute there or disagreement on that. So that revenue probably will not get collected. So whenever we have the opportunity to try to repair that hole in our budget, because going forward to 2025, we're gonna have to decide, where are we at with that? Do we continue that revenue, or are we, behind 400,000 if everything else stayed the same going into 2025, and how do we make that up? So I don't know. I'm not intimately involved. I've provided information to, to the Bad River folks to hopefully try to rectify that situation. But Dan, I don't think anything's resolved yet, correct?
No, I tried calling them today and didn't get through. My understanding is their police commission approved paying it, and it's sitting with the tribal council right now.
Yeah, and what Dan is referring to is there's 300,000 roughly sitting out there that was billed for 22 and 23. So it's not even, we haven't been providing the service in 24. I think it stopped probably June of 23 because we weren't getting paid. Obviously, the sheriff still responds to calls there, but is not patrolling as a normal course of their duties. So, I mean, hopefully that gets worked out so that budgetarily we can continue to have the relationship and that, we can provide that service to them and we get paid for it. Are there any other questions regarding anything on the report that anybody would like to ask?
Looks like we're good, Steve. Thank you.
Okay, thank you.
Next, we'll move to 5C, City of Ashland TIF 6 and 9.
I can make this really brief. The city ended 2 TIFs this year, so we are going to see a levy increase as a result of that. If we do it based on equalized value, it'd be like 200,000, but the DOR's formula, of course, doesn't favor counties and municipalities, so we're probably looking at closer to an additional 100,000 in tax revenue.
Thank you. Next, we'll go to 5D, Corporation Council fee increase.
Corp Council's asking for a slight increase in fees. I think it's $6 an hour.
Do we have a motion?
Ron will make a motion that we increase the fee.
Brad will second.
Any discussion? All in favor? Aye. Opposed? Motion carries. Thank you. Next, we'll go to 5E, opioid settlement update.
That's just an updated numbers I received from the settlement administrator, and they're self-explanatory.
Any questions or comments? Next, we'll move to 5F, capital improvement request from departments.
Okay. Bear with me. We have a new system here. So Mike put together, that's not it. So we can go this by department. So the sheriff IT. So they're requesting $60,000 in debt levy. Right? And what they want to do is replace video recorders.
Is this something that would be eligible for grant funding with the new grant writer coming?
That's something we'll look at. She's not really starting full-time till August 5th.
Right.
So we don't have to approve any of these debt levies right now. These are here so you know that these are what the requests are going for.
Okay.
If you prefer just to look at them and wait, that's great. I do have one that I would like to dispose of today.
Could we, on the sheriff, are we done with the one on the sheriff? Is that what you're saying?
It's up to you. Do you want me to go? Do you guys want to approve today or not?
Well, I had the same question as far as grant writing. And in regard to that, do you have an idea of if this is something that could potentially wait a part of a year or a year to give the grant writer time to write a grant for this? Or is this something that's pressing and one way or the other, we need to fund it?
One way or the other, we need to fund it. And I'll be honest, it's probably not grant eligible. There's just not grants out for this kind of thing. So, I mean, we can certainly have Erica look.
Okay, so what's the committee's preference as far as voting on this one now? Should we just review it and wait until another meeting for?
Yeah, why don't we, I would suggest, why don't we just review these and then vote in September?
Okay,
There's only one I'd ask you to vote on, and I'll bring that one up right away. And that's this one, the jail capital outlay. So, they have, some expenses here for jail improvements. It comes to, is it roughly 20,000? Mike and Steve point out, these can be funded with the jail assessment fund. There's 100 and some thousand in there. And there's no reason to do capital expenses. They can just do it now with the jail assessment fund. And so I guess I would ask that you just approve them using the jail assessment fund to finish all this now instead of waiting.
Ron will make a motion that we approve these expenditures.
Oh, here.
Ron, could you give us a specific number in that motion? Do we have that number handy?
Steve, do you have that number handy?
I'm looking, hang on. Yeah, let's see here. It's, I think it's 20,968.
In my motion, the 20,968, we're looking for approval.
Is there a second?
Blake, I'll second.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you.
The other one I want you to think about is the highway one. I know there's been some conversations about the equipment fund, and Matt's can't be here today because his daughter's getting married. So before we take action on that, I'd like Matt to have the opportunity to be here and make his case. But this would be his equipment fund right here. I know there's a question, several supervisors, they questioned the purchase of a plow truck, considering there was no snow last year and hardly any mileage put on there, but we'll let Matt make that argument. Two, you know, I was gonna get to this later, but they may be getting a vehicle through the EPA also. So I prefer to wait on this. But the one thing I've noted that Highway requested was a $400,000 building. There's an issue, and I believe Chief Deputy Delegan's on the phone. The Sheriff's Department needs a place for vehicle impoundment and evidence storage. Lori, can you know Mr. Brufall arrived? For vehicle impoundment and evidence storage, right now they don't have any space. So one of the ideas was, if Highway is looking for a building for office space, essentially, is to put up a building, give Highway a little portion of it, and let the Sheriff's Department do the storage there. The rationale is because there's large fencing already around the Highway Department, and it's also centrally located for the Sheriff's Department. Plus, it may make sense to consider that if we wanted to consider a new structure.
So I've got a question. The board has approved $50,000 for a space needs study.
Yes.
I could understand this topic being included on the list of what the county studies in terms of space needs. Is there something pressing about this that can't wait until that study is done?
Nate?
I guess my question would be, what is the timeline of that space needs study?
We probably won't hear anything back till after the budget's passed.
Yeah, so my concern is, with this, as I was talking to Dan, so we're running out of space over here as far as like, evidence storage and stuff. And a lot of times with a lot of the cases that we're doing now, we're storing vehicles and stuff like that in different cases. So we're renting a lot of, storage units throughout the county, and we want a more secure spot here at the sheriff's department that we secure evidence in a locked place with a secured fence around it. And with that being said, me and Dan had talked about if the highway department was already looking to put up a building to share that with us, and that would eliminate us putting a security fence around the back of the sheriff's department and then a building on top of that. A storage building.
So the highway department, there's no one there at night. I mean, do they have sufficient security for what this would entail?
Yeah, they do. I mean, they have very large fences, that are locked every night. And this
And
building.
they got
would also-
cameras.
And this building will also be secured itself.
How much storage do you rent? Do we have numbers related to the costs related to what you're already incurring as far as expenses?
I think we have 3 storage units right now that we're renting out, and then we have obviously a portion of our Sally Port here at the sheriff's department that's full that we'd like to free up for vehicles and stuff that we're using for evidence right now. And equipment. We've got an equipment room that we can't barely walk into anymore because we got so much equipment stored in it. We'd like to have a place to put extra equipment too that we have for like, whether it's squad cars or tactical equipment.
So I'm having a hard time understanding, from reading what we have in the packet, if you're gonna put that much stuff in there, and again, it needs to be secured during the day while other people are there that need to be kept out of it. I'm having a hard time understanding how you can store that much stuff there, and then the highway department still have the desired space they have. It feels, I mean, this is news to me as far as what's been said about the sheriff's department, but it feels like a bad marriage as far as meeting needs for both of you. I don't know if there's alternatives that could work better and more effectively in the long run, but this is all new as far as what was just said.
Yeah, and that's why it's just under discussion at this point, and why we wanted to bring it up to you. Obviously, the size of the structure is what would determine how it's divvied up. But there is an issue with the chain of custody of evidence too, the way we're storing stuff now. We need a more secure setting for evidence, basically. We can't just use rentable storage units. It's not very secure.
So there was a zoning meeting yesterday, and on zoning, the county is moving towards hiring realtors to sell properties that are listed. So if we're gonna hire a realtor to sell properties, if we get to it fairly quickly, could we ask that a realtor to look for properties that would meet our needs and find things that are suitable? And the chain of evidence thing, partly I'm thinking is the courthouse is here, and if you've got records down there, we're going back and forth.
This
Yeah.
this will be for the sheriff's department. They have deputies going by all the time.
Yeah, but I think it feels like a marriage of two things, and I'm not sure it meets our needs. And we know that there's other, buildings for sale. So maybe instead of waiting till a space study is done, could we ask a realtor to take a look to see what's out there? And we might find some things that work pretty well, and in the end, perhaps better for both the sheriff and the highway.
That's certainly an option. Mr. Sten.
Well, I think we need to get Matt in on the conversation also. It's a heck of a responsibility when you have a case going on and you're not able to keep an eye on that evidence at all times. It's different when it's locked up in a sheriff's department compared to 5 miles away. And you don't have law enforcement there keeping an eye on it. I think that would be an issue.
The judge is my neighbor, and I think he would wholeheartedly agree with you.
Anyhow, we'll continue looking at it. And we can look for space elsewhere.
Yeah, talk to a realtor, because if we're gonna hire a realtor anyway with zoning, selling, more homework on this and background for us to read to understand what the issues and concerns are would be very helpful.
Yep.
And then on the plow truck, and this really goes to everything on their capital stuff. The question I always ask in my mind is, from having growing up on a farm and, we used things till they were wore out and we didn't buy anything unless we really knew we needed it. How do you know something's worn out? How do you know it's past end of life? How do you know it no longer serves the function that you once had? It's a little different, for your own private stuff because employees are paid for time. So if something is down and you're spending a lot of time fixing stuff, repairing, waiting for parts, and you can't get out and, do the work that's needed and you don't have a backup, all that stuff is important too. But really everything on there, how do you know it's time to replace it? It's easy to put it on a schedule and say, we're just going to replace it on a certain schedule. But we all know we're in a different era when it comes to budgets. And for example, when I look at any capital list, I also think about somehow we got to carve things up so that we can still be fair to our employees, which we want to do. But we also have to find ways of, with the budget and property taxes, making the whole thing work. So we look hard at when are things, truly worn out. And I have constituents, I'm not kidding you, when I do doors, their big thing is the highway department. And I get asked these questions. And so I got people that I know darn well are going to want to know the answer to this. So it helps me to be able to say, here's why we're replacing anything on this list and why do you need it? In that Flowboy trailer, I got asked about that. So
Bob Piff is here. You have to speak into the microphone. Bob, you have to speak into the microphone. You have to speak into the microphone or else nobody can hear you.
First with the trailers, the trailer that we want to replace is a 2004 and it's spring ride. I don't know if you're familiar with spring ride suspensions, but where the spring rides is part of the frame, that's wore. If we need to repair that or replace it, we're reframing the trailer. We want to replace it with an insulated trailer for hauling hot mix blacktop. And it'll be air ride. Longevity of the trailer would be increased with the air ride. The main benefit is the insulated trailer. When we're hauling hot mix, we might be doing 3 to 4 to 5 culvert patches. If you have an uninsulated trailer, the mix is getting colder and colder, harder to work with. If you have an insulated trailer, retains the heat all the way through. That's the main reason.
And you can let your department head know that, a few paragraphs on some of this stuff would be really appreciated so that we know why some of these things are on the list. But the plow truck is the one that, gets mentioned the most often. We shoveled snow 3 times last winter. I'm not kidding. But tell me on the plow truck, we didn't get the snow last year that we normally would get, but yet the year before we got lots. So how do you know that plow truck needs to be replaced?
Well, as all of you know, you're driving on the roads in the winter, salt don't quit, rust doesn't quit. One of the main reasons we need a plow truck, one of the most important reasons I think we need a new plow truck every year, is half of my fleet is 2000 to 2004 trucks. When I get a new truck every year, one of the 2015s, 2016s goes in to replace that 2002 truck. If we're not able to get a new truck every year, that 2002 truck, I don't know where I would get to put $50,000 to $60,000 into that truck, which is only valued at 20. I can't square that with my outlook on machinery maintenance and forecasting. There's no avenue to replace that truck. Them trucks are in a backup role. If one of the main trucks go down in the fleet, the guys will take a backup truck.
So last winter was so little snow. I mean, you mentioned, driving those. Were you guys out with the trucks that much with that little snow? And if so, why?
Not necessarily plowing, they were out salting, whether it's freezing rain,
Okay.
freezing frost. Yeah,
You know, Pat, I think you hit it on the head is when you look at this, you're kind of like, yeah, that's too much. But I'll tell you, when you start talking, I'm like, hey, no problem, right? So the narrative of just seeing the cost is hard from a finance standpoint. But if Matt like shows me the inventory of what you're taking out, like a 2005 or 4 or something with, whatever, that helps that story so that I'm like, okay, I'm not going to question. You guys are the experts, right? Pat would use his tractor until it died and then he'd find someone to come and put that's just the way Pat grew up. And I think a lot of us here in the county pride ourselves on, but at the same time, you guys are the experts. And so I think our job is to just make sure that when you're telling us the story, just make it as clear as possible. That's my goal.
Yeah, just how many trucks, because what is the rotation? How long do you keep them? Like here, I don't know how many trucks you're running, but you're getting one every year. Is it that we have 15 and so we're basically replacing it every 15 years, every
We
20
have-
years?
we have 10
10?
plow routes. So we
So
get a new-
basically replacing one every
5
10
years.
Oh.
Every 5 years, that truck comes off the state road and goes on a county road.
Okay.
For 5 years, it's on the county road, then it goes into a backup role. So every year, a new truck goes onto the state route.
And same with the number of trailers that are on there multiple times, everything it would help to see what the rotation is and then get to Pat's point of could we extend that rotation by a year or two in certain circumstances to help do that. But like Blake said, you guys are the experts.
Just a quick question or for information. This 325,000 for the plow truck that's fully equipped. Okay. Because we buy a truck for X and then you have to put everything on it. That's where the expense is coming from. The plow and everything everything. Okay, thanks.
I've looked at Wisconsin surplus enough to know that you can buy some of these old town and county trucks for darn cheap. It's tempting every now and then, but then when you mentioned the salt, yep, I've looked at some of those. It's like, I don't want that in my machine shed. It's not worth it, given how they last. In the Wisconsin Counties magazine, this issue is July 2024 on pages 28 and 29. There's an article, Sustainable Transportation Funding in Washington County. I don't know if anybody else has looked at it, but it's a nice article in terms of kind of summing up the basics with doing your roads and your equipment. I think there's a lot of information that would help, I think, all of us on finance. Now, you said some things that shed a lot of light on things that I didn't, know prior to you speaking. A paragraph or two on a lot of this would go a long ways in helping us be prepared for a meeting and then understanding why the requests are there and then asking better questions than we might otherwise. So that background really helps. But in the long run, what I'd also like to see is some analysis. These older trucks, I think we all have had old vehicles. Some of us still do. And then you think about repair time, cost of parts and all that. And so it becomes a financial thing of how long do I keep that? And as if your own time, it's one thing. And if your own inconvenience, that's one thing. But when you're working for the county and you have a job to do, that has to be considered in the analysis too. So I'd like to see records of each vehicle when they were purchased, what the maintenance and repair costs are. There's also insurance and licensing, because then you can look at numbers and you can say, you know, you said the new one allows you to let go of an old one, and that, you know, that's a light bulb. Yeah, I get that, because that's how things are when you've got equipment. It's the old thing that goes because you got the new one. But the numbers related to these costs, all things costs, including time for employees to do maintenance, all those help us look at things and say, yep, it is time to let go of that '02 or that '04. And that's what this is really about, because I assume the numbers are such, it's not worth keeping. But I don't have those numbers either to look at. I know a number of years ago, a decade ago, the city public works were really doing everything they could to keep a vehicle going because of budgets. In fact, I saw a rusty City of Ashland truck a few weeks ago, warmed my heart. They were using it yet in the summer. But those numbers would help us, but I think that's an accounting thing, and maybe there's some software out there that, you know, could help us track those, so, you know, we know the depreciation on them.
Yeah, I think Marcy can pull up those numbers.
Yeah, it's, because we get asked questions about why did they spend money on this, that, and the other, and if you're doing doors, you know, it's nice to have some idea.
At the end of each year, we run a report, all the equipment that the highway department run that we use. It's fuel, parts, labor, and revenue. And I look at, did we lose money on that vehicle or did we make money? That is in the determination of when are we gonna replace that truck? If it starts costing us year after year more money than it makes.
So on the plow truck up there, that background that you just described, I would really appreciate in our packet, so I can look at that along with the explanation of, even though it didn't snow, we're still salting roads. And along with this enables us to let go of this older truck who, based on this accounting and records, it's essentially getting towards the end of its life.
So, Bob, can you get a report for our next meeting, or Marcy or whoever?
Yes. Yep.
For each truck for last December 31st, or what?
Yep.
And they should, and Pat, is 1 year good enough, or you want two, or you want to go?
Well, just the past year, then we have the status of that inventory and this record keeping, and it just helps us, because, you know, these are pretty big numbers, and that's all we're looking at. We don't know why you're asking for that stuff. And all this background, the paragraphs, you know, in writing that you described of why you wanted the different things. And then the numbers always are helpful in terms of the justification. So, I mean, we have to say yes or no to stuff, and those are big numbers, and we need a rationale, and that information is extremely helpful.
Yeah, like the two letters we got from Forestry on here, explaining what their big costs were, extremely helpful. I'd love to say, as long as we got the money, yes, on everything, but that weighs the decision when we're deciding where the money's gonna go.
Thanks, Bob.
Anything else on this, on the highway?
I got the floor,
Mr. Poofall?
so be quiet. I was just wondering why in this budget thing that the supervisor truck is in there 5 times? Is that in case you don't get it in 24, you'll get it in 25, or they don't wear them out that fast?
That's a very good question, and I don't think that they need to do it that often. I think that they should be at least a minimum of 3 years. I do know that when Matt's done with his truck, it goes to down the line. And then when Bruce is done, it goes into a pool to help for other staff to use, or it gets traded in. But really, I mean, vehicles like a pickup truck should be replaced every 4 or 5 years. So if we set a 2 to 3 year cycle on supervisors' trucks, knowing that Matt's going to use it for 2 or 3 years and Bruce is going to use it for 2 or 3 years, I think that's a little bit more reasonable. The other thing we should do is, again, we started leasing sheriff's department's vehicles. We should be leasing the truck also.
How many, I gotta ask you, how many miles they put on a shop truck in a year?
Bob, can you answer that?
I would say close to 25,000,
5,000?
25, 20 to 25. if we're
25,000
close
in a
to
year?
percent. What's that?
In a year?
Yeah, checking the
Oh.
road.
So every 2 or 3 years, that makes sense.
So just to, can I just add one thing? I think Matt probably has a pretty good explanation for a lot of this. And I think if we had him here, he'd be like, listen, guys, this is this. So maybe we just kind of pause until he's here, because I think you and I all agree. I saw the supervisor Chuck was gonna say it, but it makes sense if he explains it like you did. Hey, we got this 4 years, 100,000 miles, boom.
Yeah, that makes sense if it's 100,000 miles. I mean, they should replace it even sooner. I mean, they should be doing it yearly if you're putting 100,000 miles on in 4 years. I mean, but, yeah, but I was gonna suggest, and Supervisor Kinney and I talked about this already, that we postpone this discussion till Matt can be here. But we still wanted to bring it up so you guys can look at it and talk about it. And yeah, Bob, you did a great job. Yeah, go ahead. You can.
Well, and just let me pipe in and you can tell me I'm nuts, but that truck is done the same way as the plow trucks. It goes from Matt to the next one, down to the next, and then it goes down into the fleet. And some truck on the end of the fleet is somewhere. What the summer help is driving a pickup truck from how long ago? Yeah, so that's 12 years old. That's what's happening. But I mean, you can certainly do what you want, but I'm guaranteeing you that if Matt was here, that's probably what he's gonna say. And then you'd have to decide, well, is that 12-year-old pickup that the summer help is driving, which is the last one in or going out, what's the condition of that? Is it good or not? I hope it is, because you got some young people driving it.
Well, my pickup is 22 years old, so this 12 is halfway through.
But Pat, you walk or bike everywhere in town too.
Bob, thank you, and tell Matt you're going to be a tough act to follow, so you better be prepared. Yeah, thank you for coming. All right.
Okay, in the interest of time, maybe we save the rest of the CIPs for the next meeting?
Let's do the forestry, actually.
Yeah, sure.
Because I think that one feels pressing.
Do you want the radio or this other one?
Well, the radio in particular.
Okay, I think Chris Hoffman is actually on the line.
Yes, I am.
Okay, Chris.
Yeah, so we've got a radio system here that we use. Cell phones just do not work functionally out in the county forest. So 11, 12 years ago, I think it was, we got a radio repeater and radios for each employee and for each truck, and then one for in the office here. And they're just not supported by Motorola anymore. And I'm concerned with our interactions with the public and other issues getting stuck or getting lost, those kind of things. It would be nice to be able to update our radio system and make it more modern and more functional and reliable.
I agree. Cell service is terrible down there.
Yeah, it's awful.
Is this one we want to have a motion and a vote on?
I believe Supervisor Stendor has a question on one of the requests, not
What-
the,
Well, I think what I'm concerned about is the vehicle they're looking at, but I think first we should do the radios and then we can discuss the other issue. But I would like to make a motion that for the amount of $26,019 that we approve that for the radios.
and this would be going to the debt levy budget, basically. Just so everybody's clear.
Brad will second.
Any discussion? All in favor? Opposed? Motion carries. Thank you. And then Ron, do you want to go to the next item?
My only concern, Chris, was you'd put in for the side by side and you're looking at putting the tracks on it, but do you have a trailer for that?
Yes, we do.
Just my own experience, we did the same thing with the Ashland Snowmobile Club, and we bought the ATV, and it was just a 2-up side by side, but then we decided to put tracks on it, and then it wouldn't fit on the trailer. So
Correct.
maybe that's
We-
something you just want to check on. That was the only thing I really had to say on that.
Well, and I appreciate you looking out for us, but we do have a large equipment trailer that we could use if we needed to trailer it around.
Okay, I'm a happy camper.
Thank you. Me too.
Chris, this is Pat. So you mentioned that vehicle, one, the size seems, I see those things go down the road. They're big, they're almost like cars. Is that thing almost too big for some of what you want to do?
The one that we're considering is kind of a split, the difference size wise. It's not one of the smaller units, but it's not one of those great big ones that looks like a Jeep. It's kind of in between. It's a utility vehicle. But it's a 4-seater so that if we all need to go out to work together on something, or if we're involved in a search and rescue or something like that, we'd have enough seats to make it functional. So
And then-
it's not one of the great big ones. It's kind of in between.
Okay, and then you just mentioned the search and rescue, so it sounds like if Ashland County Sheriff Department could use this vehicle in a search and
Absolutely.
rescue, you guys would be working together to.
Absolutely.
Okay.
Anytime they
Yeah.
call us, we come with whatever resources we have.
Okay, all right, thank you.
Do you want to hold off on voting for the side-by-side, or do you want to do that today too?
Chris, is this something that you view as pressing, or could we just work through it in the regular budget process?
Oh, we can absolutely work through it. It's not a pressing issue. It's just something that's come up in the last couple of years is all.
Okay, thank you. So we'll leave this with the rest of the items then, but the radios that's approved.
Fantastic. Thank you.
Right, yep, thank you.
Is there any other CIP you want to discuss today, or?
No,
Say, Dan, can I jump in here a little bit?
Sure.
To show them that draft summary, that thing. It's down near the bottom. Because that lists everything summary, and then the individual ones are the information that was submitted, but I put it on a summary. And you can see, I also I worked with Matt to change a little bit of the way he was funding his assets, but it didn't materially change, or it didn't change at all the number of what he was proposing to have, but included. But anyway, the summary in 25, you can see the list of departments and then a brief 1-line item on the individual things. And if you can go down to the funding source page, I guess it's the next page. Yeah. You can see the total debt items on here, 1,552,000. That's what, as they came in, we put them in slots. Operations through annual revenues at 570 there. And I changed that from what Matt originally had, and he agreed to it. That's going to be funded by machinery revenues internally generated by the highway. Doesn't affect debt levy, doesn't affect fund balance, anything else. So anyway, that's that piece of it. But just to give you some perspective here, that 1,552,000, I think, is about 130,000 less than what you borrowed in 24. That was 1,680,000 something. So it's sort of in line with what you've been doing, but it is somewhat less. So
Something
yeah, go ahead.
that might be helpful is, when we look at the expenditures for things like that snowplow truck, is what money are we getting from the state and the townships that go towards this. So if we had that on a piece of paper with a column, just for our own comfort level with those sides of expenditures, so that we can look at the plow truck and say, okay, yep, it's over 300,000, but given the miles and the state aids related to this, here's what that covers. And so we.
Yeah,
Yeah, I think
Um,
I think we could do an average because you're gonna have winters that are different. Like,
yeah, if
last
I
year
can
was no
just speak to
snow.
that
Yeah,
a little
sure.
bit, Dan, and Pat. Okay, well, and you talked about it before, and the highway employee there brought up about, there is a very detailed record. It shows revenues generated by each truck, each piece of equipment, and then expenses by labor, mechanic, parts, overhead, everything is on there, fuel. But it's hard, probably, it's not, you're gonna get total revenues that were, that total hours times the rate that that truck was used. I'm not sure they can dig deeper and say how much the state paid those revenues, if the local, or was used on county itself. That might not go down that deep.
But
So-
even the percentages on average over several years, we'd have a better understanding of, when we look at these expenditures, where that money is coming from. Because I think, at least for me, when I sit here, I feel like I'm spending Ashland County taxpayer money, even though I know the state is paying for this, or a lot of it, and some townships. But if we don't have that information, at least in rough numbers in front of us, we feel like we're answering to the people we knock doors on.
Yeah, I think he can give you like, how much your machinery revenues are paid by the state in total each year.
All right.
Because that affects your payment you get for equipment storage.
Right.
But whether each individual truck can tell you that, but he can give you, say, like, 40% is paid by the state, in the total. That 570 is on this, as an example, at 570,025. That's paid by the county itself, the county road and bridge fund, the state, townships, whatever. So he can give you a rough percentage of that. That should be easy to do.
Yeah, that would be helpful and appreciated. So, anything else? So next then we'll go to, I assume, Dan, on 5G, you would like that approved? The change order?
We asked the company that's doing the work outside to give us a price on repairing the gutters on the roof, which was what we think is causing all the water leakage. And then there's some masonry repair that needs to be done that they found while fixing the building. So the total cost is 16,260 for the change order. And there's some pictures here to show you exactly what we're talking about. And I would have had this in the packet earlier, but we just got it yesterday.
And if they do this, this will finish the roof?
It should, yeah, except for the asphalt shingles on top of the roof, but it would finish everything else. And we would pay for this with ARPA funding like we are the rest of the building. And because it's only 16,000, it doesn't need to go further than this committee.
Brad will make a motion to spend 260 on the change order for the courthouse repair.
Blake will second that.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you.
Can we postpone the big picture discussion?
Yep, we'll hold off on further big picture discussion. On 6, we've had the health insurance update is,
It's in the packet
yep,
and Alex talked,
okay. And then 6B, county investments,
it's in the packet.
and 6C, sales tax.
It's in the packet. I will note sales tax is down, but almost every county in the state was down.
And 7, administrator updates.
Make this real quick. There's a million things. I don't think I can remember all of them here. One, we have an interview with the EPA next week on that big solar grant. An interview is the very last step to them awarding it. So we will be doing that on Wednesday at 11. It's going to be me, Bill Bailey, who wrote the grant. And the person you need to talk to about healthcare at the Tamarack, your old boss's nephew, Luke Burrow. We just received a grant for about $980,000 to fix the break rock at Madeline Island. It's a 66% covers the cost. The remainder of the cost is in the highway department's but capital improvement request. Sorry. Pat, I think Blake, I talked to you about most of these things that happening.
Well, Bad River, we mentioned earlier, you're gonna.
Yeah, there's
get in
no
touch
update
with
on
them.
Bad River. But as we all know, Bad River will move at the speed Bad River moves at. And I'm sorry, I can't remember. There's something else. I know I talked to Blake and Pat about it.
There was the Wisconsin ad that the marketing boy that.
Oh, yeah, we received all of our videos from Uniquely Wisconsin. I did forward them to several people. If you want copies of the videos, please let me know. I'll forward them to you. Please note they are still need editing, the ones you receive for sound and color quality. I thought they turned out great, and I think they hit the market that we're shooting for. I think that's it for now.
Then we'll move to scheduling the next meeting.
Okay, so let me pull up the calendar here. We do have a few challenges for the next meeting.
Well, I was gonna ask you, the trial that was going to occur, the judge has delayed it
Yes,
or whatever, so.
yes, so that trial does not happen till next year.
Okay, so I do have a question on that. So the county had reserved a bunch of motel rooms.
No, we didn't.
Okay, so we're
We're off the hook on that.
Okay,
We don't know exactly how much it's going to cost. I do plan on having a contingency fund in the budget that we can pull those costs from. And there will be overtime needed in the clerk of court's office, the DA's office, and the sheriff's department. We're going to have a deputy here full-time during the trial, upstairs and at the front door, using the metal detector. And we expect close to 100,000 in expenses between hotels and expert witnesses and all sorts of stuff, translators and everything is necessary. But again, we're going to have a contingency fund where we can draw that money from, and if we don't spend it, we have it still. So that's trial scheduled to begin at the beginning of January.
so this room is available, because otherwise it was gonna be late July into August. And so now we have this room available for the next meeting.
We have this room available for the next meeting. This room was probably not going to be used for the trial anyhow. They're going to be using the back office for extension, where there's a door to right by the front entrance. And they'll be using the jury room and maybe this room will be available in case the DA needs it. Obviously, we're not going to. But at this, and they would do jury selection over at the Breeding Center. So, but that's not till January.
The next meeting date.
Okay, so we have a few conflicts in August. I'll be gone essentially from the 20th to the 29th. And I know Dick has a conflicts on the third Thursdays of every month, which is why he was late today. So do we want to switch to a different day for next month? Do like the 14th? Dick has a conflict. There's a BART meeting every third Thursday.
Dan, you had me mark the county board unavailable from the 13th through the 16th.
What? Who did?
You did, just the other day.
No, we're talking August.
That is for August.
Oh, I need the county board next Wednesday. That's it. So is there anything else scheduled on the 14th? other than what
I'm looking right now to make
Okay, good.
sure, unless it's somebody else that has it. Um, Heather has it reserved for election returns.
Oh, that's right. It's canvassing. But we can use the room. I'll talk to Heather. She'll have it fine. It'll be fine. But yeah, the primary is the week before, so they do canvassing the following week. We'll just have election stuff around us.
14th at 2:30 again? Okay.
All right, Lori, can you remind me to talk to Heather tomorrow?
Sure. Did we pick a day?
14th at 2:00.
At 2?
Yes, please.
August 14th at 2.
If it works out, doesn't work out with the clerk, I'll send you guys all an email to schedule a new date.
2 o'clock.
August 14th at 2:00. And then do we have a motion to adjourn?
Ron will make a motion, we adjourn.
Blake will second.
All in favor? Aye. Opposed, motion carries, we're adjourned.
Well, might start doing meetings and I want to